everyone, my name is Ariana D'Alessio.
And I'm John Matsuauto.
And our evidence-based project is Interventions for Brachial Plexus Birth Injuries. A little bit of background is brachial plexus birth injuries happens when the nerves are stretched, torn, or injured that can cause sensation and movement paralysis due to difficult deliveries like shoulder dystocia and fetal macrosomia. There are three primary types of this injury. The first one is Erb's palsy, which is the most common of the three, affecting 50 to 60% of cases. It affects C5, C6, and sometimes C7 of the cervical spine nerves and impacts shoulder and arm movement. Klumpke's palsy affects less than 2% of cases and impacts C8 to T1 nerves and affects hand and nerve function. The third type is total plexus palsy, affecting the entire brachial plexus, C5 to T1, resulting in complete lack in upper extremity function. The incidence of brachial plexus birth injuries is 0.42 to 5.1 cases per 1,000 live births worldwide. The prognosis depends on where it occurs in severity, recovery speed, and initial management quality. Our objective is to determine what interventions are being utilized by occupational therapy practitioners for infants who experience a brachial plexus injury at birth, specifically focusing on infants aged 0 to 6 months. Now I'll turn the time over to John for methods.
So for the methods, we did a systematic literature search to identify interventions using different databases like PubMed, ProQuest, and CINAHL. Further articles were found by filtering through each article's references related to keywords such as brachial plexus birth palsy and shoulder dystocia. Inclusion criteria includes peer-reviewed articles about infants aged 0 to 6 months diagnosed with brachial plexus birth injuries and interventions initiated within the first 6 months of life. Exclusion criteria, interventions after 6 months of age, and literature not addressing interventions and management of BPBI. Results and discussion. The main findings of this evidence-based project highlight the importance of early intervention in the management of brachial plexus birth injuries in infants. Occupational therapy has an important role in the rehabilitation process within the first 6 months of life, optimizing nerve regeneration and improvements with motor training. Various interventions include range of motion and strengthening exercises. Splinting and positioning strategies emerge as early management to prevent contractures, maintain joint flexibility, and support proper healing and development. Now I'll turn the time over to Ariana for clinical implications.
Occupational therapy practitioners assess infants with brachial plexus birth injuries to measure outcomes and impact of movement. Early assessment and intervention using tailored therapeutic techniques can increase better outcomes. Practitioners collaborate with multidisciplinary teams, including families, to guide rehabilitation decisions that promote long-term function and independence. Suggestions we came up for future research is to develop standardized protocols for brachial plexus birth injury rehabilitation, accounting for varying injury severity. Use technology to gather information from diverse healthcare facilities, increasing sample sizes and data collection, and to address the research gap in brachial plexus birth injury rehabilitation to develop more effective approaches despite low incidence rates. Now I'll turn the time back over to John for limitations.
So for limitations, limited research exists on BPBI in infants aged 0 to 6 months, and the lack of established treatment protocols leads to variability in care. The low incidence of BPBI also making studying effective treatments. In conclusion, brachial plexus birth injuries affects infants' upper limb function, with early interventions within the first 6 months being important for neuroplasticity and improving long-term outcomes. Occupational therapy practitioners employ various strategies, including exercises, splinting, and family-centered education, and to empower caregivers, and reinforce therapy at home, while non-surgical interventions are prioritized. Surgical options and medical treatment may be necessary in some cases. And we just wanted to point everybody down here at the bottom right of our poster to the references. It's a QR code. You're welcome to scan that. And we wanted to give a special acknowledgement to our professors over this project, Dr. Jennifer Belay and Dr. Sheila Longpre. Thank you so much.